Good morning. Welcome, and thank you so much for joining us today. We're very happy to have you here today on this very special day for us. My name is Scott Harris. I'm a state health officer with the Alabama Department of Public Health, and again, let me welcome you. Today we're going to be talking about smoking, and in 2012, the CDC began a program called the Tips from Former Smokers Campaign, or TIPS program, which brought actual smokers and not actors, but actual smokers out to talk about their experience with smoking and with secondhand smoke, and in particular the impact that had on their health and on the lives of those that they know about. And we're very happy to have with us today one of the people from the TIPS campaign, Tiffany, who's going to talk to you in just a minute and give you her firsthand account of smoking and secondhand smoke. Smoking is one of the biggest public health problems that we have in our nation and indeed in the world, and we appreciate you bringing this message out so that people can hear just exactly how dangerous smoking is. This is an issue that we want to publicize as much as possible, and we just can't get enough publicity for it. So thank you for being here. We know that close to 500,000 people a year in this country die from tobacco smoke and tobacco-related illnesses, and even with that number, there are probably 30 times that number who are living with chronic health problems related to tobacco. In Alabama alone, we expect about 8,600 people will die in a year from tobacco and tobacco-related issues. 8,600 people equates to about 24 people a day, one person an hour. So during the hour that we're here in this press conference, there'll be another death in our state from tobacco, and another death in the next hour. And that's every hour of the day, 7 days a week, every day of the year. We know that about 21% of people in Alabama smoke, about 1 in 5 people. That's higher than the national average. Only about 15% of people smoke nationally. Smoking rates are declining everywhere, including Alabama a little bit, but we're certainly not declining as fast as other people, and we would like to improve that. This is an issue that affects not just health care, but our economy overall. The direct health care costs of smoking in our state are about $1.8 billion annually, but there are probably as much as $2.7 billion of lost productivity from workers who are dealing with smoke-related illnesses. So this is a huge economic issue for our state as well. It's not only an economic issue, it's not only a healthcare issue, but it's a real issue for the lives of the people that are affected, people who smoke, people who are faced with dealing with secondhand smoke, and the people that they care about. So at ADPH, we're very happy to have our quit line, and you'll see on the sign over here a phone number that you can call toll-free. If you're someone who's dealing with tobacco addiction and is interested in quitting smoking or using tobacco, please call. You're eligible for free counseling, for an individualized quit plan. You can get nicotine replacement therapy if needed, and you have someone who can talk to you and understand what you're dealing with and try to get you through this. So again, thank you so much for joining us. At this time, I'm going to turn this over to Tiffany, who will bring us her message.
Good morning, and thank you, Dr. Harris and the Alabama Department of Public Health for inviting me to share my story. I am a participant in CDC's Tips from Former Smokers campaign. Even though my mother died of lung cancer from smoking when I was 16, I started smoking myself a couple of years later. My friends smoked, and like most teenagers, I wanted to fit in. I was also coping with the stress of losing my mother while at the same time coping with the stress of being a teenage mother. I smoked off and on for about 20 years. Continuing to smoke while knowing that I lost my mother to cigarette smoking was very difficult emotionally. I realized that I needed to quit for my daughter so she wouldn't go through the same thing I went through when my mother died. I wanted to be around for her prom, graduation, and all the little moments I missed with my mom. Setting a quit date was very important to successfully quitting. I also used the nicotine patch, which really helped with the cravings. Using the whole course of nicotine patches and following through were my keys to success in quitting. And like many other smokers, I have struggled with the urge to smoke. Even after being quit for 2 years, I began craving cigarettes again after I gave birth to my second daughter. She's now 4 years old, and I want to provide her with a healthy, smoke-free mother and environment. My advice to those who smoke: find your motivating factor for quitting, whether it be your own health, your friends, or your family. I encourage anyone interested in quitting to call the Alabama Quit line. I quit, and you can too. Now I would like to introduce Jenny Campbell from the American Cancer Society Cancer Action Network.
Thank you, Tiffany. I'm so pleased to be able to be here in support of the Quit Line and this wonderful service that's offered by the health department. Tobacco use is still the #1 source of preventable illness and death in the United States. It's also the single greatest cause of excessive health care spending, productivity losses for employers. Tobacco cessation coverage is one of the most cost-effective health insurance benefits that an employer can provide. Very few people are able to quit smoking at any given attempt on their own. Smoking cessation counseling and medicines are proven to help improve quit rates. Tobacco-based services are a convenient, effective way to provide information and counseling. Because of this, tobacco-based cessation programs have quickly become the most successful way to help large populations quit using tobacco, nearly doubling, sometimes tripling, a tobacco user's chance of quitting for good. Smoking causes immediate damage to your body, which can lead to long-term health problems. As you heard from Dr. Harris, 8,600 adults die from smoking-related illnesses each year. For every person who dies of smoking, at least 30 Americans live with serious smoking-related illnesses. Smoking can cause 12 different kinds of cancer. In 2018, more than 10,500 are expected to die from cancer, and almost a third of those will be from because by cigarette smoking here in Alabama. In addition, smoking causes COPD, emphysema, asthma, heart disease, stroke, poor circulation, acid reflux, low birth weight in babies, vision problems, and many, many more conditions. Life expectancy for smokers is at least 10 years shorter than for non-smokers. Now is the time to quit smoking. Within minutes of smoking your last cigarette, your body begins to recover. You will look better, you will feel better, and you will save money. Free help is available by calling 1-800-QUIT-NOW. 1-800-QUIT-NOW is the Alabama Department of Health cessation program. QuitNowAlabama.com. It is a free, individualized quit plan. So they will help you put together your own quit plan. They offer free counseling, up to 8 weeks of free nicotine replacement therapy if you're enrolled in the counseling and if you're medically qualified. It's available through Medicaid. If you're on Medicaid as well, just call your Medicaid provider. The Quit Line is open from 6 a.m. to midnight every night. Free services are available to any Alabama resident. It's never too late to quit using tobacco. The sooner you quit, the more you can reduce your chances of becoming ill and suffering from diseases. So we're happy to answer any questions. Thank you for coming today. We appreciate your attention.